want to ask you, what children with what dysfunction of muscular pelvic floor can visit to physiotherapist?
What kind of children need to have the treatments with physiotherapist? It's a very good question. Thank you for the question. And it is an interesting question because we know that even children may have some pelvic floor dysfunctions. For example, anorexia, problem or urinary incontinence, especially for the children who are over 5 years old, 6, 7, or 10, or even 15 sometimes. These children really need to go sometimes to the physiotherapist to have the treatment which is non-invasive for the children. We can help them to explain to the children so that they can gain confidence and they can control their urine activities and others, and so on. Imagine a child who has incontinence at school, primary school or middle school, and that child can, that symptoms can affect even the studies. The child is going to be psychological, a little bit down. So going to the physiotherapist to regain control of the functions of the bladder, it's going to give the child the confidence to work even at school. So another thing we need also to know, there are also some children who have constipation problems. The children who cannot even go to toilet for 2 days, 3 days, but they're children. Some of them, they are even 3, 4 years old. These young children with constipation, if we don't treat them early, this constipation sometimes may not overcome, and it's going to be a big problem in the future for these people because we are preparing the next generation. So these children of 4, 5, 3 who do not go to toilet regularly every day, and if we do not take care about such kind of chronic constipation, it's going to be very, very difficult. So I think physiotherapists, they have possibilities. They have tools which are non-invasive, good for the children, with sometimes with lydic, and it's funny, it's interesting. And so I will encourage the parents who have children with such kind of condition, whether it is incontinence or whether it is constipation, to go to physiotherapist, to seek for the treatment. And I would like to let them know that most of these treatments are completely non-invasive. There is no surgery. It's just using electrodes externally, using the biofeedback. It's simple, it's lydic, and the children will have the treatment playing at the same time. They will have fun with treatment. So I think all of them need to get such.
So the physiotherapy is very useful for the children.
Of course.
Urinary incontinence.
Children with urinary incontinence, with a chronic constipation, they need to go to see the physiotherapist because the physiotherapists, they are well trained. They know a lot of techniques which can be applied to children. They go to the training, they are experts in this field, and then they can work together with the pediatrics, with the physiotherapist in a multidisciplinary approach to help these children solve the problem.